With regard to the forced tapering issue in recent times of chronic pain patients from their opioids, I've been asked, how do we get consumers and health professionals working together again? Perhaps we need to have a forum whereby patient representatives and doctors have equal input into the policy under which chronic pain patients have been treated so unfairly recently. Many legacy chronic pain patients have been taken away from their life-saving, mobility-restoring opioids, and they weren't on high doses. Many of them suffer from intractable pain, high-impact pain, 24/7 a day. They need opioids every single day. We're not talking about a high dose here. We're talking about something that achieves certain quality of life and able to get around most of their daily activities of living. Perhaps there's a problem here with the media perception that opioids are inherently and chemically addictive, which is not true. There needs to be a dispelling of certain myths and also a classification between what is really addiction versus dependence. We need to talk about how doctors perhaps are trained. Do all doctors know what hyperalgesia is versus sensitivity to pain? Having a forum would be a great idea for all these ideas to come together in a unified way without us and them. Many patients I've become aware of in recent times have been prevented from receiving their opioids under a normal authority through the TGA. Unbeknown to them, their doctor, for their own reasons, has put them on a DDU authority, a dangerous drugs unit authority, to receive their opioids, often substance abuse disorder drugs such as methadone and buprenorphine. I mean, they may work for pain, but the patient thinks they're receiving these as part of the usual TGA legislation when it's now under the state health authority for them to get their painkillers at a drug clinic for substance abuse. This is not the way forward for chronic pain patients who've done nothing wrong. Perhaps we even need a simpler review system. Currently, chronic pain patients receiving opioids must have a yearly review in order to receive their opioids in the future. And often the specialist or doctor reviewing them doesn't know their history, doesn't know them at all. Their GP knows them best. Many of us are very good opioid citizens. This is a term I heard recently from Associate Professor Michael Vag, who said just that on the 25th of July during National Pain Week. Many patients have done nothing wrong, are using their opioids as prescribed. So we need to have a voice. We need to have a shared responsibility with the medical profession. Thank you.